Has your little one had a hip ultrasound done to check if they have developmental dysplasia of the hips? Do you understand the results of those hip ultrasound scans? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to talk about the significance of hip ultrasound results. So here at My Favourite Physio, we see lots of babies and toddlers, and often we are checking little ones and their hips. So hip ultrasounds are taken for babies when they're under 6 months old. The main purpose for hip ultrasounds is often to check if baby's hip joint was well formed when they were first born. If there's a family history of, hip problems and hip dysplasia, we would then be checking on baby's hips. If there is concerns when baby was being checked at birth for a clicky hip or a hip that seems to pop in and out, then a hip ultrasound will also be asked for at 6 weeks old. The big issue is when a baby has a hip ultrasound, very often parents don't understand the results of it, and so there's no follow through if baby needed treatment. So I thought I would jump in and talk about the two measures we look for in the hip ultrasound. The first is hip coverage. We want to know how much of the thigh bone is covered by the pelvic bone. If it's not well covered, it may mean that the hip can pop in and out. And if the hip is completely out, then there will be zero coverage, which means we really need to do something to fix baby's hips. Otherwise, baby would not be able to walk. The second measurement that's really important to look at is the shape of the pelvic bone. So we're looking to see how is that shape angled at. Is it shallow like this? Is it covered out round? Or is it completely straight? And that angle matters because we didn't know if baby's hips are going to slide in or out, or is it sitting nicely and firmly in that position. Having known those two measures, it would then determine whether or not we intervene with a pelvic harness or a hip spiker, depending on the child's age and the condition of the hips. The whole purpose of intervention is to ensure that we correctly place baby's thigh bone to angle into the pelvic bone to deepen it up as they kick their legs, so that when they stand up, there's a nice hip joint to stand on. That would mean that baby would have healthy hip joints for the rest of their lives. So in that first few weeks of birth, it's so important to ensure that baby's hips are checked correctly by a pediatric physiotherapist. So if you are out there and you've just had a newborn baby, not sure if someone's checked your baby's hips well, or perhaps you were told that maybe baby has a clicky hip, maybe they need an ultrasound, why don't you give us a ring here at My Favourite Physio? Speak to one of our expert pediatric physiotherapists. The number to ring is 0297904233. And if you know somebody out there who's had a child who had a hip ultrasound scan but never followed through on it, why don't you like and share this video with them? Until next time, have a fantastic day. Bye.